I have been working with the BEAM team ever since I came to Stoughton Health. I believe that's been about 15 years now. Started with just Dr. Patel providing that inpatient services for us, and obviously has expanded now to 24/7 practice at our hospital.
The nighttime telehospitalist program was really a game changer for us because it really allowed us to have the coverage that we needed, but not the cost associated with having someone have to be physically here on site.
At first we didn't know how our elderly population would like it, because it used to be that we'd have to wait for the providers from the clinic to come over to see the patients, and it was very sporadic, and patients would be in our ER for very long periods of time. Now, from the time that we call the provider, the hospitalist, and to them getting admitted is usually less than an hour. So it's been a great turnaround for both the patients, the staff.
My predecessor, Terry Browning, brought them in, and it has elevated our level of inpatient care. We retain patients that we might otherwise have to transfer going forward. So it was definitely the right decision for Stoughton. They're very committed to the hospital, to the employees. They work well with our nursing staff, very patient with families. It alleviates the stress and pressure of having to recruit an onboard physician. BEAM takes care of all of that, is willing to go above and beyond when the organization needs them to, which we certainly did during the pandemic.
And I think it's helped with the functioning as far as the efficiencies in the hospital, as far as getting patients in the hospital, getting them cared for, getting them out and getting them placed, as well as the efficiencies of ordering appropriate tests and just monitoring the inpatient programs that we have.
The BEAM team is really a great team to work with. They're very agreeable and easy to work with in terms of changes that might be needed from a contracting standpoint, as well as any of the sort of financial things that need to go along with.
But we've been able to work together really well to make sure that we're striving for that common goal, and that is good quality care for our patients.
We've learned from one another, but most importantly, I have just always found them to be very receptive and resourceful. We work together in coordination, and I really appreciate that from them. They're fantastic.
Collaborative.
Collaboration.
Partnership.
Patient-focused.